are going to call the meeting to order. Good evening, everyone. My name is Autumn Francisco. I am the chair of community engagement. We always start with the icebreaker, and it is June. And next month, we will be mimicking City Council with their July recess. So it's only right that our icebreaker for this month is, what is your favorite summer activity? We are 2 weeks away. I'll start. Um, I like to be outside. I don't like bugs, but I love just being out in nature, feeling the heat. I took a walk to Franklin Park this morning, so it was a nice day to do that. I actually had to be outside for a couple of hours for work as well. It was just nice. It's not too hot today. I'll go this way.
Thank you. Greetings and hello, Siobhan Thompson, District 4 Area Commissioner. What is my favorite thing to do summer? I enjoy chilling in my backyard in my little oasis. So that's important. What do you like to do in the summer?
I like to play in the summer and talk all the leaves around.
Love it.
Maryland Pool. Hi, I'm Jacqueline Kelsey. I'm District Commissioner of NEAC, Vice Chair. My favorite summer activity is swimming in the pool. It is so clean and so fun, and I cannot wait. It opens on Sunday. Yeah.
Thanks for going.
It's exciting. They've got water slides.
Good afternoon. My name is Sharif Benson, District 4 Commissioner. And my favorite summer activity is traveling and gardening. I know they don't go together, but I take care of my indoor plants in the summer, and so that's my gardening. So
This Brian Wine, this is US's. My favorite summer activity is festival season, and next week is like the gateway to festival season downtown. Yes, this Sunday, 6/7. We're celebrating the Franklin Park Summer Mingle. I have flyers. It's
always 7.
although there's plenty of stuff to do Saturday. If you go outside, there's plenty of stuff. There's like called the Community Day, Traditional Treasures. Look at it. Just go anywhere like Old Town East or your East Side. There's like something new. The Eastgate has the yard sale.
Well, hi everyone. My name is Annie Curtis with 1S.
No relation.
No relation. So I work with the Columbus Care Coalition with Miss Autumn at Columbus Public Health. My favorite summer activity is also just being outside. As Autumn knows, I never miss this. I can't help this. I will park my car and put the window down and do work in my car.
I'm pulling in the parking lot and she's outside.
Yeah, I mean, I can't stand the windows don't open. I can't handle it. If I see if it's nice out, not raining, even if sometimes it's raining, I just need fresh air. So I'm anywhere underneath the shade. I'm not really keen to the sun too much. I don't like the heat right on me, but I'll find my shade and do that. So.
I'm Lisa Paul. I work for Primary One Health, and my favorite activity in the summer is sitting outside and laying on my hammock and crocheting. And festival season, I think that's one of the best parts of Columbus is all the perks that we get for all the festivals. So I'm looking forward to that.
You joined us at the perfect time. So our icebreaker is, what's your favorite summer activity?
Oh, okay. I'm Natasha Davis. I live in the Boston community. My favorite summer activity, probably yoga in Topiary Park. Oh, nice. Is there like there has been in the past, I can't remember who sponsors it, but yeah. And so one week when we thought they were having Did anybody?
Nathan Harris, favorite summer activity,
Who are you? Who do you represent?
District One, member of the Community Engagement Committee. Favorite summer activity is, riding my bike on our lovely trails here in the city. And then my favorite suburb, Bexley.
Are you going to the home tour this weekend?
Oh,
In Bexley?
probably not.
Favorite suburb? No.
This is.
That would be nice.
It sure would be. I don't wanna get my hopes up.
Since we're not meeting next month, maybe the fireworks opposite the.
Oh, really? So
City there, city council voted on that, I think, right before Christmas, yeah.
So we did 2 fireworks.
different summer.
All the east side suburbs, their fireworks in the third longer.
Oh, because July 4th this year is on Saturday.
So you said it's the opposite of Columbus's?
I see we did it for July third.
Oh, so
The day before, Friday.
Oh,
Yes.
okay.
So what, the boom's on the second still? Oh, no, they moved it to Friday.
Yeah.
Next year, it was to be on whatever day Friday is.
So make sure
Ah.
we're following the second, yeah.
Mm.
Or dogs. Like they won't have.
Yeah.
Friday, Saturday, every
And
day.
then there's 250th anniversary celebration downtown, like Kappa's doing, free movies, concert, which we ticket to, the fireworks afterwards, there's stuff on the State House lawn.
Yeah, it's gonna be busy.
I look outside.
I'll be in the deep south. Yeah, I'll be in the deep south for July 4th. Good old South Carolina. You know, no fireworks.
They don't do fireworks in the town? Why would you be there?
Family.
That's where my grandmother was from.
That's kind of neat. There's ambiance in the background. You know how people have those TVs with the black LED lights? You don't do that during,
So, hold on, one more time. I'm gonna look it up.
It is. Like, it's just been over.
I'm so sorry.
Yeah, but the city. So you can't go live on that.
Okay, thank you all for sharing. So we do have a guest speaker, Ms. Lisa Hall. She is the Chief Community Services Officer with Primary One Health, so she has a presentation for us. You can feel free to stay seated, you can stand up, whatever feels comfortable for you.
We'll
This
make
is
it a
very-
conversation. I don't wanna I brought slides, but I really wanna make it a conversation since Primary One Health is the oldest and the largest. That means that 25 years ago, they were put together by the city. So the city of Columbus, there was a federal health qualified center that was having financial issues, and the city said, we can't let this fail. So the city started to financially support that health center, that it became Columbus Neighborhood Center, so that is now Primary One Health. I was in the board for Primary One Health for about 3 years before joining the team. During my time there, Primary One Health was going through significant financial losses due to COVID grants that they have received, 340B, that is a funding that some health companies get through pharmacy funding. And all of that had changed significantly, and they were in a financial crisis. We were able to hire a new CEO. We were able to hire a new medical director. They hired me. So we have pretty much 75% of the senior leadership team is brand new. And the goal was to how can we get Primary One Health back to what it used to be and to be respected as the best place for people to receive care in our community, no matter their ability to pay. So our mission is to provide access services to improve the health status of families, including people that experiencing financial, social, and cultural barriers to healthcare. This is more important now than ever. As you know, the insurance in the marketplace is extremely expensive, so people are making a choice of not getting insurance whatsoever. As we know, some community members are not able to legally get insurance because they don't have a legal status. So we want to be the choice for them to come and receive care. We get funding from a federal grant that is called a HRSA grant. So we get subsidized by caring for people in our community. So we want to be the best place for them to come. So we are a center medical home. So we have the ability for a family to show up and we're able to take care of the entire family and address many different needs. We're able to provide medical care. We got PCPs. We're able to provide behavioral health services. We're able to provide vision services. We're able to provide dental services and substance use disorder treatment. We are recognized by NCQA. We meet their standards, and that is extremely important for us, and we're very proud of that. But again, we lost a lot of providers when we were going through that during that crisis. We used to have about 13 clinics. We took it down now to 9 clinics that are only in the city of Columbus. There were some decisions that were made. It's fine. There were some decisions that were made to get Primary One Health outside of the city, and we needed to realize we need to be where we are needed. So that's what we have done and go back to our core services. We work with our patients to provide healthier lifestyles at our, if you go down South Parsons and you go to Joe Maloney Center, we do have a physical therapy facility that we work with physical therapist students from Ohio State. So it doesn't happen every day, but several times a week, we're able to offer physical therapy to people that otherwise wouldn't get physical therapy. So that is something that we provide. You can go to the next slide. So like I said, primary care, we have physicians, we have nurse practitioners, we have medical assistants that are providing adult care, geriatrics, we provide preventive care, chronic disease management, we have LabCorp, we have a contract with them, so every clinic, you're able to go and see your doctor and get your lab work done. So it's a one-stop shop, you don't have to go to multiple places. We do have a pediatrician and staff that is able to do well visits, physicals, and immunization. And we just revamped it. The women's health area. That is something that we have always had. In the women's health space, one of the programs that I'm responsible for is the Healthy Families program. You probably have heard of the program Help Me Grow in the community. So what we do now with Healthy Families America is the same thing, but it's for families that come to Primary One. So they already getting their OBGYN, their prenatal care, and now we're wrapping around staff from Primary One Health, following them from perinatal all the way to 3 years old. And what they're focusing is on malnutrition and the well-being of the children and the, so it's a pretty incredible program. It is all funded by the state. We will take care of families that are not part of Primary One Health. So if you know of a family that is expecting and you think they could benefit from those services, you can let us know and we will enroll them in that program.
Can I ask what services that program provides?
So we have what is called a family support specialist. This family support specialist could be a social worker or a community health worker. They go through a 6-month training to learn about all the different stages of the mom in the perinatal space, as well as first year, second year, and third year. And they do home visits. And not only do they provide resources, but they teach the mom what the appropriate stages of development of the child, and a lot of education of how to raise that child correctly. And kind of break that cycle of poverty as much as possible with resources and assistance for them. So it's a pretty cool wraparound services. that I'm really proud that is under my leadership because you see the difference with the families. And that's our future. So for us to be able to follow our children for 3 years to ensure that our community is gonna be okay, it's really cool as a social worker for me.
Well, this comes with health, because we have a variety of certain things like that, we like the Celebrate One, and then we have maternal
Yes.
health, and then we have the Safe Sleep, I'm wondering if like your
We're part of it.
department, I thought so,
Yes.
but I wasn't sure, I was pretty sure if you're not.
We give them, trips, we give them
Okay,
trips.
great.
To the moms,
Okay.
and we have 2 community health workers that are paid for by Celebrate One
Perfect.
that are working with our moms on the women's health program.
Wonderful.
So this is a collaboration across not only private entity like us, nonprofit, but government also supporting, our community. The other program that I oversee is the behavioral health program. We have, behavioral health therapists across, our sites, but I wanna talk about the one on Main Street that is right next to the, neighborhood house. Thank you. I can't. So we're making that area, we used to have a contract with Southeast that we used to do behavioral health with them. We stopped that contract and we moved to Main Street, and we would like that place to be our place for behavioral health. We offer, we have 2 therapists and staff. We have a, substance use disorder physician, and I can't say it, but it's an addiction specialist. So you're able to come in and you're having withdrawal symptoms and you're able to get tested, and screened, and you're able to walk away with medication immediately. So that is something that is extremely important for our community. You might show up for the flu and your doctor is seeing you and they're screening you and they're like something here. There's some signs of addiction. We're able to immediately link them with a behavioral health specialist, get them in medication and start them in treatment. In that facility, we also have an intensive outpatient program that is 12 hours a week of, substance use disorder treatment. So they come in and they're there for 3 hours. They have a peer support specialist. A peer support specialist is someone that is in recovery, that has been trained to support somebody that is newly to recovery. And that is something that we're extremely proud of that program. It was provided to us by a grant through the state of Ohio. So we are very proud to have that in the community. Because you hear about a lot of IOP programs, but this one is embedded with your primary care physician too. Yes.
There's a 2-part. The first part is, you mentioned that you had partnered with Southeast, and then you're no longer doing that, and you moved the behavioral health to. My question is, why did it move from this material? There was a primary one right off of Broad.
Now we're on Main Street.
I know, that's my question is, why did they move?
Because when we looked at it, you think about it, you're paying for double administrative, and we were not getting the amount of patients that we needed to keep that office open.
That's what they told me.
Yeah, we.
But my question, I guess.
So that's the initial thing when we were going through our financial decision making, because we were having financial troubles. We had to take a look at all the clinics and look at the clinics that we were able to continue to serve the community in a way that we can still support the staff.
Because it was a great loss for this community, that's why I'm asking.
Yes.
And the behavioral health portion, isn't that in all of the clinics? Maybe not the IOP.
The IOP is not in all the clinics,
you
but
have-
behavioral health is in all of them.
And do you have peer support staff?
We don't, because it's a grant funded position, so we only have the
You
peers.
have one?
Yes, but what we do is she travels. So she's able, so she's able
From
to,
one site to the other?
yes, yep.
Okay, 'cause I think I remember, it might have been last year, that someone from primary one came and we talked, because I'm a recovery advocate, and she had mentioned that you were hiring more peer support staff. So I was kind of
Yes.
surprised to hear that there's only one.
Yes.
And that she's traveling to the other.
So it's a
one.
grant fund, it was a 1-year grant.
Okay.
So I don't know if a year ago they said that the grant was gonna fund more than one person or not. So I don't know why there was only one, but definitely I'll go back and say, hey.
It's been a long year.
Yes, I'm like, I can go back and find out the reason behind it, that decision wasn't made. No problem. But it was really difficult to move from southeast. I don't wanna minimize that because you're central, you're like in East Broad. But at the same time, I wanna make sure as an organization that we stay solid. And sometimes we have to make some tough decisions to make sure that we can continue to meet the needs of the community. The other part that we're providing that a lot of you might not be aware is that we have emergency dental services in Parsons. And we're the only one in Central Ohio that I provide services. And you don't have, the goal is for you, for your physician, for Primary One Health to refer you there. So you can get dental services, but we are trying to avoid people from going to the emergency room. And it's a first come, first serve, and the staff here from CPH can tell you that there is a line every day we see at the dental.
And staff, they're lacking staff right now too, so be patient with the staff.
So again, the goal is to meet the needs of the community, services that they're not receiving. But we're in challenging times, so we have to make some tough decisions so we can be sustainable. Our doctors are board certified. We provide diabetes management. We provide blood pressure management. We work with Ann Health to have a dermatologist and neurologist, and we also have a pharmacy in Agler Road. So it's not as close to here, but you can get extremely discounted prescriptions if you get your medications from them.
I have a question. So you mentioned earlier in regard to the addiction services, or the behavioral health rather, they can leave with medication that day. So if they do not use the primary one,
We
pharmacy.
will have it delivered. Agler Road will deliver, will home deliver to them.
Gotcha. Are they still able to maybe take it to like CVS or Kroger?
Yes, they
that's
can.
Closer to them?
We have had patients that will go to CVS or Kroger, if they have a schizophrenia, they take one, shot every week. They can go and pick up the prescription. We have one, that picks up the prescription at Kroger, comes to our clinic on Parsons, and our nurse practitioner gives them the medication.
Thank you.
What insurance do you?
I'm gonna
sure
cover
you
that
will.
in the next sheet.
It's a great
I
question.
love it, I love it. And that's the part that I'm more excited about. Let's go back to one of them. So again, dental care, like I explained, we offer it on Parsons Road. Vision care, we have, my glasses are from Primary One Health. As a proud board member, I've been getting once I joined the board, I started to get all my vision services from them. I could not believe how reasonable the frames were. Going from an optic in Easton that I used to get my glasses to going to Primary One Health, I really could not believe how affordable it was, and it's because it's subsidized. So if you know of anyone that is struggling, please let us know. We can help them get glasses, and we also have a partnership with Prevent Blindness Ohio to get vouchers for people to get glasses. We do have extended hours on Saturdays at certain locations, so you will have to call in. It's not a open access, so you have to call in to get an appointment on Saturdays. But again, I already went through all of that, so we can go to the next. Okay, so one of the things that we have is the healthcare for the homeless program. Right now, we partner with the Salvation Army, Jordan's Crossing, and Stowe Mission. And we have a community health worker there every week that ensures that community members are able to apply for healthcare insurance if they qualify, and that we're able to get them into medical services, dental, and vision. No matter if they have a place to live or not. One of the things that we lost was the grant for cell phones. We were able to offer cell phones for the own house, and that is something that we're working to see how we can get that back. But that is a program that we still get referrals today. And our community health workers are extremely proud of that program. We used to go into the streets with our mobile. We don't have the resources to do that. My goal is like maybe in a few years, we will have a grant that will be able to support that. But right now we can't do it, but we still go to very specific places. Especially, we have the Family Center Community Rehab, Franklin County, right next to Alba's house, and I can't remember the name, but any person that is going to be released from prison In the next 6 months, we're able to schedule them medical appointment with primary one here. We have a clinic right next to Mary Haven in Alum Creek. So we're able to get them in Medicaid because they will be able to qualify for Medicaid. And we're able to get them medical care immediately. So that is something that we're really excited about. The other program that we're doing is like any new immigrant coming to the state of Ohio, they come through Columbus and we're doing physicals for them and vaccinations for the entire community. So that is something that we're really proud of that we're doing, because, we don't know what the circumstances where the family come from. A lot of them are coming from refugee camps, so they haven't been vaccinated, they haven't seen by a doctor, so we're providing those services to newly immigrants.
What is the location for that service? Is there
Um,
all primary?
Agler Road. Agler Road, so, you can call me, if you know of a family that newly arrived, and we have a community health worker in Agler Road. We have a former refugee physician, and we have a team that is very comfortable in that space, working with the families and the trauma.
What if they potentially been here, but they don't receive services or anything like that? Can we get them?
Send them our way, and they can go to any of the clinics.
Do you have translation services?
Yes, we use Propio, that is an iPad, or we can use telephonic, for any of the languages, yes. Next one,
Is Agler the largest location?
West Broad,
West Broad is? Oh,
yeah, right on the
'cause it's-
hilltop.
yeah.
And then this is your question, the insurances that we have, so we cover Medicare, we cover Medicaid, all the Medicaids, in the city, we cover them, we cover commercial plans. And then for the uninsured, we have what is called a sliding fee scale. So you can show up, you can bring a pay stub, a letter from your employer that says, hey, this is how much you get paid every 2 weeks. And we're able to tell you how much you have to pay for, for the services. Yes,
Now, for the sliding fee scale, so I don't for insurance and my paycheck's direct deposit. What would I do to show proof of income?
you can just show them your bank, the bank statement, that it shows from your employer direct deposit to your accounts. Yes, and it covers, the sliding fees covers x-rays, lab work, medication, primary care, dental care, vision, so it covers behavioral health. So it covers all of it. And every year the board votes for those, sliding fee scales. And then we provide what is called a presumptive eligibility program. We have community health workers that have been trained in the marketplace in job and family services, so we can help them apply for Medicaid. And we have a job and family services person that comes to our clinics once a week, rotate per month, to help those more difficult families and cases to apply for Medicaid. Across the city.
Okay, so we just have to.
You just have to you just have to call us, and then we'll be able to say JFS is gonna be on Parsons on this day, we're gonna put you on the
That's
schedule. It is we get a lot of calls from CPH, there's a Spanish speaking community health worker there, that he sends us a lot
Oh,
of.
yes, my NSS, yeah.
Yes. Yeah, from Celebrate One. Any questions regarding this part, because I think this is the most important part of the whole presentation.
So I have a question.
Yes.
What percentage of your funding comes from patients that have commercial health insurance versus all of the other insurance programs?
That's a great question. I can tell you that 64% of our patients are not insured. Sorry, 67% of our patients are underrepresented communities. And 47% of our patients are Medicaid. And the rest of it's a minimal component what we get for Medicare and commercial. So if you think about it, we want to have more Medicare and more Medicaid so we can meet the needs of the community. So that is something that that we have been very intentional about. In order for us to continue to do this and continue with the HRSA grant, we want to make sure that we bring more Medicare, more Medicaid patients, so then we can continue to keep the sliding fee reasonable and lower. Because that is not happening across the city. The sliding fee at other institutions, they have to move them up, and we don't wanna go that route.
do the commercial insurance, like, maybe I have this backwards, do they reimburse you all more than Medicaid, Medicare?
Commercial doesn't. Medicaid is the only one because of the HRSA grant. So if you think about it, yeah, so commercial doesn't, but, and that's okay, we have great partnerships with the Medicaids across the city, like we're getting ready to throw a baby shower in July with Molina. We're working with them also to do what is called an MCO day. It's for them to show up with a big band and we get the healthy wellness visits for everybody and do giveaways. So we're trying to get them more involved in our community. So families can feel comfortable with their Medicaid, insurance.
Question, this might be kind of narrow and specific, but the senior population,
Yes,
I'm thinking of actually someone in mind, but where they go to your dental clinic and everything, and they've expressed to me that their insurance is not covering dentures or all that kind of stuff. So, I mean, like, and they're on a fixed income because of Social security, I mean, that population usually is. One is what percentage is seniors, you see, and two is their, I guess, how does sliding fee scale work if their insurance is covered?
so what will happen is, like, they will have an insurance and then the sliding fee scale will kick in. So they will have to work with the front desk when they show up and say, hey, this is what is happening to me. We don't want to tell people to not receive services from us, so we're willing to work with them to understand what their financial situation is. But if it's something specifically, I'll give you my card before I leave, so you can, yes. So then you can, they don't have to go to a front desk, we can figure it out and be able to meet the needs of them. Any questions regarding this slide?
Well, sorry, can I just repeat back kind of what I heard? So if somebody has, this is what I'm interpreting, if somebody has commercial insurance, they're on fixed income.
Usually they will have Medicare.
Yeah, like.
They will have a
write
Medicare
back
Advantage or
insurance?
Medicare Straight.
So I feel like it'd be very rare that somebody with commercial insurance and ideally backup
So
Medicaid.
the
would
problem
even
with,
take those
Dental
the
is
problem with
specific.
Medicare is that you have to get a Medicare Advantage to cover vision and cover dental, and that's an extra cost. So if you're not able to afford it,
Then you just.
the question is, could they qualify for a MyCare program? Could they be in Medicare and Medicaid, and then the Medicaid will cover the dental, or do they fall into that space that their income is too much? And they're not able to afford the dentures, but they're not able to afford Medicaid, so I need to,
It's
just
the
a very
income of
gray
social
area.
security, they take the income of the household too. So that's also, it's just a unique.
So it's a rare scenario, weird situation that we have totally figured out, because it seems odd to say that like your backup if you don't qualify is the uninsurance sliding scale. Like, wouldn't then everybody who doesn't qualify for Medicare care then come to you guys for discounted?
if they don't have insurance.
But what if they do? I'm saying,
If
what
they do have insurance, there's people that are underinsured.
Okay, so uninsured and underinsured.
There's an
Okay,
underinsured component to this.
got it.
That is
Okay.
like, they have medical, so their medical services are covered, but dental is not covered.
That totally makes sense. I just was really hung up that it said uninsured. I'm like, well.
I like the underinsured. that was a
So
great question.
underinsured is an important thing.
Yeah.
That was, thank you for letting me.
No, and I like the feedback because I can add the underinsured, and that's where the sliding fee scale comes in.
Thank you.
So if I am correct in what I'm hearing, you don't, and I know you don't turn anyone away, but we people with commercial insurance are not your favorite people. They
No,
don't help the bottom dollar, correct?
no, absolutely not. They do because you're a guaranteed payment. Think about that.
Maybe I misunderstood. Because I'm also confused.
Yeah.
I thought you were saying commercially insured patients don't reimburse the clinic as much as
They
Medicare.
just, it's just a contract that you have with the insurance company.
Okay, so it depends,
Yes,
but it could
but
be
no,
as
we,
much
like,
as.
let's say that I have primary one health insurance. I'm guaranteed, and I go to primary one health to see a doctor, I'm guaranteed that my insurance is gonna pay for that visit.
Okay, So the reason I'm asking is I specifically get primary one health
Yes.
after I got my new insurance as my health care, because I wanted to support the clinic in the neighborhood.
Yes.
But then I must have misunderstood.
No, what I was trying to say, and this is where the Spanish and the English comes to play with me. And what I was trying to say is that Medicaid pay us at a higher rate.
Okay, like more of your patients, like
Yes.
as a percentage of the people that
Yes.
visit the clinic, okay?
Yes, so we want to serve those Medicaid patients
Because they're majority of.
because the majority of them, because we are getting reimbursed at a higher rate.
Okay, so but
no,
hypothetical, what if 100% of your patients were commercial? What would that do to your financial picture? Would that be better or worse? That will help me understand, like.
are we meeting, the question will be, are we meeting the needs of the community?
Yeah.
Something is really wrong there,
Yeah.
because then that doesn't represent the city of Columbus.
No, I understand, so what I'm, like, the reason I'm
There's
asking
a
about,
social
I
worker
wanna
and
understand
you're
if I'm
like, oh.
helping, I want, yeah, no. I wanna know if I'm helping or making it worse, so I get what you're saying, but
Yeah.
hypothetically, if 100% of your
Yeah.
patients were commercially insured, would that be better for the financial picture of primary one or no?
I don't know, because it's not realistic.
No, okay, let's say 80%, let's
No,
say 80.
I will have to you have to then get into contracting and how much
Yeah,
each
but
insurance pays.
so the reason I go to
Yeah.
primary one is not
Yeah.
because I have to, it's because
Yeah.
I thought I was helping, because.
You are.
Because FQHC struggle from this
And
particular
that's
problem
why I
all
go.
the time.
That's why I go, because I have insurance.
Yes, so.
So it does help.
Okay, that's what I wanna make
That's
sure I'm
the
not
answer.
hurting, you know what I mean? Like, I don't wanna say I can go somewhere else, but I don't wanna be hurt, cause I wanna make sure that my dollars are also cause like, if you
They're
make money
contributing
from
to the
the, yeah,
mission.
from the commercially
Yes.
insured, you don't have to rely as much on grants.
Yes.
Because hopefully the contracted rate is better than Medicare, Medicaid.
Yes.
And then those funds, like, if grant dollars rise up as they did about a year ago, you know why, it's been a long year, you guys can still survive if enough of your patients
Yes.
That's a good
are,
point.
are reimbursing your clinics at a higher rate than the grants and funding.
You need to do my job.
That's what I was gonna think about that.
I'm done. I'm gonna-
Considering where I take my insurance at.
But if you think about it, yes, I am benefiting them by going to get my
Yes.
eye care there
There,
and
yeah.
getting my primary care there.
And the reason I say that is that's kind of one of the things I preach, as someone in the room will tell you, is that, you know, we all have the option, especially when you're privately insured, to kind of go anywhere. You can go to OSU, Children's, wherever. You have options. And so you can, you know, what they say, vote with your dollar if you want to, and I want to make sure I'm supporting primary
You are.
one. And I can advocate for you all I want in the hopes that the city or the federal government or the state gives you money, but if they don't, I can make my insurance company definitely give it to you
And
by coming for a visit.
we're very grateful to the city of Columbus for their support, because the city has been able to support our mission, because we have so many people that are uninsured and we have the highest rate of Medicaid.
Okay.
Even though you get paid at a higher rate,
Yeah.
it's still not enough to support the mission.
Yeah.
So when I say higher rate, I don't wanna say that it's profitable.
Yeah.
So I wanna be very careful with that. But what we have been able to find is that with the support of the city, funding is able to keep the mission going to meet the needs of the community.
As long as the city continues to be, that's why we want the city to be profitable.
But I think it's important to show the information and what our population looks like that is different from other federal health qualified centers and where we are located too. I think that's also a key component. If you look at where we are located, again, it's the underrepresented communities and the marginalized communities that we just need to make sure that we're there caring for them.
You said that you get Medicaid paid at a higher rate. What about Medicare? Is there a difference in the Medicare, just regular Medicare, not Medicare?
People, it's the same.
Oh,
Fee for service.
So it's whatever rate then your clinic sets is what they reimburse you for.
Yes.
Okay, versus private, which wants to negotiate.
They wanna-
back and
Yes.
forth.
okay. That makes sense.
But what I can tell you is that from the time that I've been there, we have really good relationship with our insurance companies. And the insurance companies want to help us and partner with us to meet the needs of the community.
I would think that it would be even more beneficial to the insurance companies, because it seems like it.
You're keeping the patient away from the emergency room.
Yeah.
And from going to the hospital, so
And so, then therefore, hopefully, the services that they need are gonna be cheaper.
I love this.
It's not a lot of time in primary, so.
Thank you.
Yeah, I was
Thank
there
you.
during COVID giving out vaccines and then shortly after doing my rotations as well.
That's awesome. Thank you. We appreciate it. I'm telling you, I'm the happiest I've ever been. I feel very connected to the mission as a social worker. Next slide. Or it might be the last one. Okay, so we have 9 locations. East Main Street, Agler Road, we are in Linden, where St. Vincent's, is. Refugee Road, it is right behind the Church of God, Church of Refuge.
First Church of God.
Yes, thank you, thank you. Again, I'm taking you guys on the road with me. Agler Road, do you know where Homeport and Columbus Urban League is? Right there, we're across that building. And then, we also are located on West Broad Street, right at the Hilltop. Alum Creek Drive is right next to Alva's house. So we have a great partnership with them to help, their patients as they're getting discharged. And then we have Parsons location, that's where my office is located at. And then we also have one in Circleville, in Pickaway, Fairfield Hospital. We have been there for many, many years, meeting the needs of the rural community there. And again, I went over all of our specialized services. So this is very easy to become a patient. Just call us and get an appointment scheduled. And then when you come in, just bring your photo ID, insurance card, medication list, and proof of household income, if you bank statement, if it's direct deposit. And then on your first appointment, you're gonna meet with your provider and establish a plan of care for you. And if you're underinsured or uninsured, we will go over your sliding fee scale. I think that's it. There you go.
I have a
Any
question.
questions?
I do. Is the West Broad office at the same location as the WIC office?
Yes, and we've moved out.
Really?
Yes.
Wow. I like when there's multiple like hubs in one city.
Speaking of which, primary one, just to plug you guys, is the Eastern Prosperity Center that's gonna open up on the east side of Refugee. Primary one's all over.
That was my next question.
Yeah, there's a new location. about to happen.
So I'm sorry to burst that.
No?
We won't be there. It's going to be, and it's good, it's Ohio State Total Wellness.
Oh.
That is gonna be the.
Oh, I'm so sorry. I thought
Center.
initially it was primary one.
It was.
Okay.
It
I
was.
thought it was primary.
Yes, primary one
Okay.
health was initially
Okay.
going to be
Oh, that's
there.
unfortunate. I mean,
But we're down the street, we're down the street in Refugee.
You're
Did you take a picture of it?
Crisp, clean,
I see what you was trying to do, but I wasn't gonna stop you.
Sorry, I was listening to instructions before my brain actually kicked on.
Thank you, everyone.
Wow.
Thank you.
I need to come more often.
I
I
will say-
appreciate all of you guys.
6 of those
We
locations I know
appreciate you
have
being
good
here.
bus access, so that I can say that.
That's the other part.
It seems intentional.
When I took the job, I remember going to every single clinic and looking where's the Coda bus stop. You are absolutely correct. We give bus passes if needed. And we work with patients if they have a situation with transportation and they have Medicaid, we will work with their case manager to get them transportation too, so.
Bus systems getting bigger. Stressful.
Thank you so much. I feel like I've had questions about what primary one is and how it functions, because I have only ever existed in academic medicine, like my entire life in Columbus has been at Ohio State or at each of my children's. So I know that these clinics are out there, but don't have a good way to interact. That is so good to hear about stuff happening in my
We work very closely with Nationwide, and we work very closely with Ohio State. We work very closely with Mount Carmel, and we're also getting ready to work very closely with Grant. So as a federal health qualified center, we partner with everyone that wants to partner with us because we know the need is there and be collaborative. So, it's exciting to be in an organization that is willing to make those partnerships for the better of the community, so.
I mean, I know.
It's very different.
I'm sure that these connections are being made, have been made, I guess, as one of the work reviews, though, I'm just not like too, it's not part of my like daily work life, so I don't know how you guys.
We do a lot of research.
It's so cool to hear. how-
We do a lot of research. If you think about it, we have an incredible population that trust us to make sure that we're gonna provide the best care possible. So if there's something innovative that is trying to be implemented, or some research grant that is trying to be implemented that is going to help this community specifically, Primary One will collaborate with that organization to make sure that we are there at the forefront.
You guys refer for clinical trials then?
Great question. That's a question for Dr. Polonia.
Okay.
That is out of my scope.
Okay,
I
understood.
mean,
I have another question. Sorry.
I was just, yeah, go ahead.
Do you see use for vision services?
Yes, yes. And if you go to West Broad, I had a full Spanish speaking team take care of me. It was the first time in Ohio that I walk in and everybody's like, hola, and I'm like, where am I?
Wait, so do you know Jaime then?
Yes.
Okay.
Jaime
He's
is
one of my
from my
favorites.
town.
Are you serious?
And he went to school with my brother here in Columbus. So Jaime is a special.
So is your brother a pharmacist?
No,
Or when they were
no.
undergrad?
Yes,
Okay.
undergrad. The Ohio Dominican.
Yeah.
Dr. Papastani was one of the pharmacists that taught us, and now he works in health collaboration with Marcus Law.
So cool.
Ophthalmologist at Nationwide is always backed up.
Yeah,
Always.
I know that eye clinic, and I don't know what their insurance.
They're dental as
situation is like.
well.
Yeah, dental and I refer all my rare disease kids to them. And I still don't know how their clinics really operate. Like, I know that eye clinic has one clinic that sees commercial insurance, but another one has to see the other. I imagine it's kind of.
Yeah, and sometimes you have to go somewhere for the glasses. It's a lot.
It is a lot.
I'm telling you guys, go see for all of your screenings and then glasses online. Just pay $20 then.com. Get your glasses ready to go.
I'm 2020.
Yeah, not me.
I'm blind.
Yeah, so blind.
Yeah.
Yeah, I know. I remember when I was growing up and glasses cost like $300. The first time my mom ever had got me glasses, it was like, it's okay. I don't need to see. I'll be fine in school. They're like, you can't see. Yo, I don't know what happened. Like, glasses went from being $300, and now online you can get frames for, mine are literally $60. So like,
Frames are.
yeah, yeah, the prescription's a little bit more.
So
Yeah.
they do the test.
So
But you're looking at that's the part that I'm like, I don't feel comfortable.
yeah, the place I go doesn't do it. Like, you still have to go somewhere to get the test, but
Okay.
then you can get your prescription just like a pharmacy.
Yeah.
And then you can take that online to order
But you know
your
when
glasses.
we draw our glasses on and then check are your ears crooked
Yeah.
and then
Oh, yeah.
and then they do the dots.
That's why I wouldn't go online.
So, maybe it's cheating, but like Walmart will let you just come in and they'll adjust your glasses for you at the
That's
vision
true.
center. Cause I used to go to them to go get my glasses. And so I was like, I bought glasses from you one time. They don't even ask. I'm just like, yeah, these need adjustment. They just assume they're what you got it from there. Cause they're like, how do you know we do this? Yeah, you just go in and they'll adjust it
Yeah, that's
for
true.
free.
That is true.
Yeah.
I'm
Mine
here
are
for
actually,
it.
I say that because they literally
Yeah,
adjust
Walmart.
I fell asleep.
Support group or something.
But when it comes to vision, I'm part of the board for Prevent Blindness Ohio for the state board. And we do have a voucher program, for people that cannot afford glasses, so they shouldn't be anybody in the state of Ohio that if they need glasses, they should be able to get them for free, and it's through VSP. So, and the teachers, the nurses at the schools should know that when the kids get tested, and if they know that they should be able to give them a voucher for VSP. And if not, just let me know, because it's across the state of Ohio. Social worker, right?
Yeah, same here. I'm just told public sources, but this was very important.
Yeah, like high yield information. It's great.
Are there any additional questions? Thank you again for coming.
Love it, anytime.
Yeah,
So
what
good.
time
My
is
birthday.
it?
It's good to see you.
7:30, meeting adjourned.
Oh, not just.
She has someone else. Oh, you just clicked the button. No, not adjourn. Keep recording.
Before we leave, are there
Is that a note
any
taker thing?
community events that anyone would like to share? I know Brian just gave us a handout for this weekend.
South of Main will be meeting this Saturday.
Again, 50 things happening this weekend. Hello.
You can list the 50 things.
I have a couple things. I have a couple things. Well, one is, this is called Steps of Hope. And they have event next Saturday called Blossom. And they're uplifting and honoring, recovery, survivors. It's, very empowering. It's pretty much for adults. You can bring some young girls and young adults, but their stories might be a little graphic. Because talk about trauma and testimony. I know the founder, I'm volunteering. So the fashion show is free and has a catered lunch. So bring your sisters or your, family and stuff, so it's gonna be really nice. Oh, I have tons of flyers. Yes.
Oh, you deleted it?
You hear it?
Okay, I'm trying to go on and just remove them all, because I found one.
This must be a
And then I have one more.
Cause I ain't
I
seen
have a
anything.
13, 16 through 21. There's just 2 hours on Saturdays this summer. There's gonna be professionals that come in, like Officer Culver. I don't know if you guys know who that. Yeah, he's gonna come speak for the kids. So it's like financial literacy, trauma resiliency, a whole bunch of different things for workforce. 16, 21, free. It's just a couple hours on the south side, but you don't have to be on the south side. And I know the founder also, and she's amazing. So I'll be doing one of my workshops.
You sent these out. to the kids,
Alright,
right?
so community network.
You as well.
I said, yeah. Yeah, I'm on.
Okay,
Oh, this
I
is
was saying, I
me.
saw him.
Yeah, I wanna check it out.
So he must have dropped you off.
Okay, anything else? Brian, did you want to share more about the mingle or?
Oh yeah, so we have live music from 2 to 4. Copacetic is back. We have the same food trucks as last year, Queen's Table. There'll be pretty much every festival, including Confest at the end of the month, and Hot Times right after Labor Day. Queen's Table, Johnson's Ice Cream, Spanish Bowl. There'll be activities for the kids. There'll be amazing raffle prizes, which my fellow board members are picking up right now as we speak. There'll be a cash bar, and it's not going to rain. If it rains, blame Jack Nicholas. And then also, since there's no NEAC anything in July, Old Tech East Tour of Homes, July 12th, 12/5. Starts with Fran Ryan, and one of the commissioners has volunteered his house to be on the tour.
Which one?
Hey.
Which one?
Secretary Rice.
Oh, yes, yeah, Bob.
Really?
Mom's house is
Yeah,
right on
you
there.
can do this.
I ain't going back to back. Wait, so it's extended all the way up this way again?
So it's gonna be, I think they're, yeah, it's like, so there are homes like, north of Broad, and then basically the heart of Old Town East, and then it's like basically like Woods.
Oh, wow. They gonna be walking this year.
And we have like maybe like, I say like 10, 11 stops.
Yeah.
It's a good number to have.
Yeah.
So, the Church of Brighton, Ohio is
Yeah.
a stop, a bonus bathroom stop.
Awesome.
Is there, so the Fran Ryan is where it's gonna start.
Okay.
So, never been there, I think that it's amazing.
Oh, yeah.
So they have classes during the day for people over 50, so.
That's good. I didn't realize they was coming north of Broad again this year.
I think there are like a couple stops.
So it's interesting, you never know, like, where the cutoff is gonna be.
Yeah. That's cool. Especially go all the way down to Lincoln.
It's like, even like the trash and treasure.
Mm-hmm.
Yeah, I mean, yeah, tractor like rock hole your east side on Saturday. I think East Gate's doing their own separate yard sale on Saturday.
Oh, and
There's East Side Pride and Colors Brewing Company on Saturday.
we got the East Side Pride.
Yeah.
Wow.
So,
Down at Columbus Commons in Zora's House of Joy Fest is on Saturday also. I wanna say 1 to 6 or something like that.
Is that through Zora's house?
Yeah, I was on Saturday.
and then there's over at MLK the other night, they had this flyer about Legacy Point Community Day on the 27th.
Yeah.
Yeah.
It's ready to point community day 27.
Which is like last month's meeting. There's a lot going on,
There is.
especially once you guys are
Let's
gone.
not
And then,
forget Juneteenth on the 8th.
yes, on the 20th, and then August 4th, National Night Out.
And that's also my birthday and Rock's. Just throwing that out there for him. Yeah. No, he shares one with me.
Got you.
I was there. Could you tell me the legacy?
Okay.
What was the date on the legacy?
27.
It's the last Saturday of this month.
The zoning tour will take place July 9th. The locations, it'll become a graphic, it will be emailed, of course, but the walking tour we did with Roy, the locations are 1608 Greenway, 1384 Fair Avenue, 542 Kelton, and then we're ending at the Long Street corridor. So we'll look at the deal, Delphi and Ogden.
That's the what you would call it off of it. Well, I didn't tell specifically.
Which one? Franklin
Franklin
Rising?
No, it's on the other side. I don't. It's almost done, so like it's probably not far enough.
Yeah, just text it to me. I can respond. I can email him to tell him to
It's July
include.
9th, a zoning tour.
Yeah, I missed the last one. I don't wanna miss
Oh
it.
yeah, it was a good time. It was a good time.
So,
Yes.
you know anything about the election process for
Yeah.
Yes.
this year?
Mr. Biden too. The city hasn't announced. Yeah, we can say they haven't announced yet when elections can take place, but we've already edited all forms and things like that. But then there's the signature form that comes directly from the city that has not been shared with us yet. They haven't said anything about elections yet. The Department of Neighborhoods.
Oh, no, I mean, I think it's based on whenever y'all are ready. I think y'all have discussed forming a committee.
Yeah.
But
But
historically,
y'all normally give us the form and everything. It still has Carlos Scott's name on the last signature sheet that was for last year.
Yeah, okay, I will provide an updated template, we do have that, so I'll send it over to you all.
Okay.
What usually the election committee does is they'll update, obviously, the dates, depending on your calendar. We provide a template and kind of saying like, what are some dates. We usually pick like this, for the citywide elections. I know the last couple of years, obviously, we try to make a push, but then some commissions don't have competitive elections, so that kind of falls through the crack. But the date is usually, I think, the 4th Saturday of 8th of August, so I'll send that information to you, but I will definitely provide you sign-in sheets, and then, like I said, just the election committee will go through and kind of set what deadlines they want to do for when it's submitted, when they review it, when they certify, and when they notify the candidates and if the candidates.
Fantastic. Yep, thank you.
thank you.
So yeah, so Brian, once we have that updated information, we'll push it out via email to inform everybody. But I've already made updates to the website and everything, so we're just waiting on those documents. We'll be good to go.
Any other comments or questions or events before we adjourn? Seeing that there are none, I will entertain a motion to adjourn.
So moved.
Meeting, it looks like everyone's all in favor, so meeting adjourned at 7:40. I'm so excited for you.